today, Nancy. Thank you, Nancy.
Oh, you're welcome.
You can help yourself over
Yes.
here after.
You know, breaking for the summer, I was like, that's fine. That makes total
We have a couple of healthy options. Right, Dave? Show.
Good morning, everyone, and welcome. I know that it's May. As I said, May did not get the memo that there are no more showers in May. That those are supposed to be for April. My name is Julie Jennings. I am a member of the Southcoast Collaborative, Worksite Health and Wellness Collaborative. I'm also the Vice President of Employee Benefits at Sylvia & Company Insurance Agency in Dartmouth. And I've had really the pleasure of being part of this collaborative for the past, I don't know if we're counting, 5 or 6 years. And it initially started, for those of you who are new to the collaborative, the history of the collaborative started out of a concern from the state of Massachusetts about the health status of people in the South Coast. When we looked at factors like the prevalence of heart disease, cancer, obesity, the numbers in South Coast were higher than they were in other parts of the state of Massachusetts. So there was an interest from the state to put some resources down here to help employers start thinking about ways to impact the health and wellness of their employees. And so began the South Coast Health and, it's always such a mouthful. If someone wants to come up with a new name, I'm all for it. The South Coast Worksite Health and Wellness Collaborative. So what I'd like to do this morning before we get going on the program is I would like to, as we usually do at our meetings, just let everyone introduce yourself to the group, if you'd like to say who you work for, but also if you could just briefly say what you hope to gain for your work site in terms of health and wellness, either through this program or through your initiatives at your workplace. That would be great to know. And can I start with Michelle? Okay, thanks.
Michelle Cabral from Blount Fine Foods. I'm the Human Resource Benefits Manager there. And I'm just hoping to get more ideas regarding wellness and health for my employees.
Good morning, I'm Sheila Whitaker, and I'm with UMass Dartmouth in Organizational Development. And I would agree with that statement. I'm trying to bring different programs to promote a healthy work environment, and actually planning an employee wellness week for the first week in June.
Sandra Lamb, Horner Millwork, Human Resource Rep. I, like Michelle, also we're trying to bring new ideas and something for our wellness that we're having this summer.
Okay, great. Jason.
Thank you. My name is Jason Colbert. I'm one of the owners of ED Health and Safety Solutions. With my partner here, Josh Foley, that we do injury prevention and wellness programming for local businesses in the area.
Well, thanks. It's interesting to know like who is at this meeting, and from you're identifying like what business or organization you're with. We definitely have within this room larger employers as opposed to small employers. Sometimes we go to things, and definitely wellness is something that that small businesses also are concerned with bringing to their employees, and there are wellness credits in the state of Massachusetts and under the federal health plan to encourage businesses of all sizes to adopt wellness platforms. But I think that definitely we have a lot to put on the table for large groups today. So there are some traditional resources, both what we're going to present today, what Nicole is going to share with us from her work up at UMass Lowell. And we also, we call this New Frontiers in Wellness, because we're branching out a little bit from the traditional topics of wellness today to talk about some related areas to wellness. And Gary will explain a little bit more about what he does with the medical guide. And Tara Healy, our last speaker, who is, she's a slower swimmer, I think. She's expected within the next hour or so. But Tara Healy is she leads up the mindfulness initiative at Harvard Pilgrim for their employees and for employers. So I'm really excited to hear a little bit more about that, because it's really looking at our employees in the total picture. It's not just the walking programs and the healthy eating. It's definitely where our heads are at. You know, how happy we are in our lives, how happy we are in our jobs, how focused and engaged we are in 24/7. So I hope that you get a lot out of it today, and I want to thank you again for all coming. She came to the Wellness Collaborative for our annual conference 2 years ago, I think it was. And so she has been working very diligently at UMass Lowell on wellness initiatives, and so she's going to share with us today the newest and most exciting and engaging, I hope, tools that are available to Massachusetts employers. She's Associate Professor and Chair of the Department of Community Health and Sustainability. Her doctorate was earned at Columbia University through the Center for the Promotion of Health in the New England Workplace, a NIOSH-funded Center of Excellence associated with the Total Worker Health Initiative of the agency. She is the co-principal investigator for Healthy and Safe at Work project. So let's welcome Nicole. Thank you for coming.
Thank you for having me. So this is a very nice place to come because I'm from this area. I was actually born in New Bedford. I'm a grad of Bishop Stang High School, 1985. So I wasn't 12 when I started at UMass Lowell. I lied. And my mom was actually an occupational health nurse at St. Luke's for 1 million years. She retired several years ago. So this is nice to come home. And I get to spend a little time with my mother as well when I come down to this area. So sort of moving beyond the traditional wellness, the traditional health promotion, because I think our program at UMass Lowell is really embracing that. And it's really a part of what NIOSH is trying to embrace with integrating occupational health and safety with worksite health promotion. So I really think that this is the direction that we're going here. Let me just get to the beginning. So again, we are part of, we're a research and innovation center up at UMass Lowell. We're part of the Total Worker Health Program, which is funded by the CDC NIOSH. We are part of a collaborative with certainly us, but UConn Health Center and UConn Stores, so it's more of a regional kind of research and innovation center. There are actually 4 of these around the country. Harvard has one. Iowa has one, Portland State has one. So they're trying to really bring this to the nation, this idea of integration. And integrating what? Integrating worksite health promotion, which I think a lot of you have that familiarity with, but really looking at workplace safety and health as well. And Total Worker Health is really about integrating, implementing, evaluating the kinds of programs in workplaces that can kind of marry these concepts, which I think you probably know live in very distinct universes sometimes. So our project is really trying to overtly bring these 2 worlds together. And we do that, sorry, this is a new thing. No, it's me. I need to be a little more. So the big key words you're going to hear today are integration and participatory approaches. And that's really what we're trying to do, is we're trying to come up with sustainable interventions that lead to sustainable solutions. Nobody's happy when we have this wonderful impact evaluation that shows that our walking program or our Weight Watchers at work or whatever was a successful program when you go back 6 months later or a year later and you've reverted back to your old numbers. It's like, that's very, so we need to start thinking about what are the outcome evaluations? What 6 months, 1 year, 3 years out? How are our sustainable interventions actually leading to sustainable solutions, which may, in fact, have an impact on workers' comp claims, on health insurance costs, and some of those tangible kinds of costs that employers are so interested in. We all should be. So the first part of this program that I'm doing today is really to hammer in on why these 2 concepts are important, integrated and participatory. So traditional health promotion, you all know this. What are you targeting? You're typically targeting disease prevention and risk factors. We want to increase exercise, we want to improve people's dietary intake, we want to eliminate smoking, and we want to address obesity in a number of different ways, and metabolic syndrome. So those programs are certainly programs that look at behavior modification. Of course they do, and that's fantastic. But at the same time, we have to understand that these risk factors are also, obesity, poor diet, physical inactivity, are also risk factors for other musculoskeletal disorders, which are more associated with occupational safety and health, and injury prevention, and those kinds of things. These worlds naturally collide. We, as worksite health promotion people, my background is in health promotion, not occupational safety and health. But again, being one part of the equation, I think it's an important part of the equation to bring our health promotion expertise, but at the same time to marry our efforts with those of our occupational safety and health friends. So really making sure that ergonomic risk factors, as well as those diet, physical activity, smoking, et cetera, risk factors are looked at, because we know all of these are affected by what? The physical, psychosocial, __, and work organization features within that workplace. So it just makes sense. If we're not doing these things in tandem, working together with occupational safety and health promotion, we're actually undermining our own efforts, I would argue. We typically live in silos. It's comfortable. We know where we are, we know what we're supposed to do. It can get a little messy when we start to integrate these concepts of occupational safety and health with health promotion, because health and safety has their marching orders. We reduce hazards and exposures, and we have our marching orders, reduce lifestyle risk factors. But again, we're marching sort of to the beats of two different drummers oftentimes, and total worker health is saying, no more. Please work together. Please facilitate these kinds of conversations so that we can get to a place where we have sustainable interventions that lead to sustainable outcomes. What is the integrated approach? It's actually having a coordinated planning effort and having all levels of an organization participate in that planning. And our toolkit project, that's what it's been about, is integrated approaches, participatory models. So again, workers are an important part of this. It's not just the folks in HR whose responsibility it is to make people healthier. It's grassroots efforts from engagement with those workers at all levels of the organization, which we know some organizations run the gamut in terms of socioeconomic status. Healthcare is a great example of that, but really to involve and include all levels of that organization, as well as the wellness people, yay, wellness people, the safety people, and also the management, which have to be a part of this decision-making process to allocate resources to allow people to have the time to engage in these kinds of efforts, which I'm going to describe today. So a paper was published by the research team at CPH New, which really articulated some of the very important outcomes of integrating, of having that round table with all levels of the organization and all sort of disciplines around worker health and safety coming together in health promotion. So root causes, again, not just Band-Aids on we need this and we need that, not just a programmatic focus. That sounds fun. Let's do it. That's fun. I mean, fun is always fun, but let's try to think about what's the root cause of some of the factors that are affecting health status of our employees. And that doesn't just come. That's not just something that you know in a moment. You have to really dig in, and you need to research, and you need to understand from the worker's perspective also what some of the root causes of some of the health concerns might be within that workplace. Participation and sustainability, there's shared resources, there's some benefits that bringing occupational safety and health promotion together, it makes good business sense too for the employer. So we're always it's a straddle, it's the quality of life. We want employers to be healthier because they'll be happier and they'll be more satisfied with their lives, and all those quality of life metrics. Those are the ones I care about. I'm not an economist, but then I've also had to come to appreciate the idea of cost savings and return on investment and all of these other ideas which are critically important. So both sides of that argument I think are really important for all of us to understand. So why participatory? What's the big deal? Why should we're the experts, we're the ones who are paid to actually do this stuff. So why involve the employees? Well, a few different reasons. First of all, it can increase, and this is based on research as well, improve employee self-efficacy, meaning they believe they can engage in these kinds of programs and these kinds of health-promoting activities, and they can do it successfully over the long haul. So improving self-efficacy is a really important thing. It increases their decision latitude. One of the key predictors of job stress is actually low control, we call it, low decision-making latitude, meaning people don't have any voice, people don't have any opportunity to participate in decision-making. This model in and of itself enhances that right off the bat. So that's another one of those benefits of a participatory program. So I don't need to read all of these to you, but certainly that self-efficacy, that belief that as a worker, I look at myself sometimes as I'm just working here, but to have a seat around a table that's trying to make that place better is a very important model to have. And then, boy, do they know a lot. Why engage the employees? Because they know a lot. Their finger is on the pulse every day, which maybe those of us sitting at innovation and research centers don't know. Those of us sitting in HR departments might not know. but engaging and making it a participatory process really gets you to better understand the real deal, what's truly happening within the context of that work environment. So we have this new toolkit. Our goal is to have this toolkit be used by people. Because we all have things, and 15 years ago it was sitting on our shelf collecting dust, and now it's maybe in our favorites on our computer, but again, it kind of just sits there and it just doesn't get utilized. So we are pulling out all the stops to try to get people to actually engage with and utilize, perhaps not the total toolkit project, which is the Healthy Workplace Participatory Program Toolkit. We're good at long names too, but maybe to understand kind of how this process might integrate with the work that you're already doing. We field tested this toolkit. This was supplemental funding that we received from NIOSH a couple years ago now, and it was a 2-year process to really develop this toolkit program. It's been, again, pilot tested and evaluated at 4 employers in Massachusetts, and I think we've had some good success. I think it's like any other tool. It needs to be adapted to meet the needs of the organization and the workforce it is serving. That may be industry specific, that may be size specific. So really this toolkit is not a one-size-fits-all, it's not a magic bullet, but it gives you a set of tools to engage in a process that, again, hammers home on this idea that integrated programs are great programs and participatory approaches are at the heart and soul of successful workers' health and safety programs. So the toolkit really was trying to address what the project CPH New and Total Worker Health perceives to be shortcomings of these traditional health promotion programs that are a dime a dozen that we see out there in the real world every day. Little employee ownership and participation in the process of building those things. Again, working conditions. Looking at how working conditions, we know, for instance, when I was here 2 years ago, I probably did this. When work stress goes up, participation in health promoting behaviors goes down. So if you're not addressing work stress, your walking program is probably not as effective as it could be. Or your fitness challenge, or your whatever the other programmatic pieces of this puzzle are. If you're not addressing stress, which again may be facilitated by psychosocial working conditions, which may include low decision-making latitude, it may just include a workload that is absolutely unbelievable. It also may include risk factors like low social support in the workplace, a toxic work environment in terms of how peers are interacting with one another, how perhaps supervisory and management staff integrate themselves in the organization. So those are some of the conditions that a walking program is not going to, it's maybe a little stress reliever, it's great to kind of get out, but again, if we're really looking at getting at the heart and soul, we have to look at some of those working conditions. So that we see as a liability of our traditional health promotion programs. And then activities can be event-driven. Let's do this. Let's do this for that month. Let's, we're very, and this is all good. And we're very oriented to the Lunch and Learn series. The different ideas that we have on something needs to be done, so let's do this. And we're action-oriented, which is great. This process has us perhaps being a little bit more thoughtful and reflective, both on the way that we integrate our programs with occupational safety and health, as well as how we engage and underscore the importance of participatory approaches in getting this done. And a lot of those programs, again, they lack the sustainability. You go back a year later, you're very disappointed at your outcomes. They have not sustained themselves. So some of the nitty-gritty about this toolkit, some of the really essential features here. How do we do this? How does this toolkit help you to embrace what I've just said, integrated approaches and participatory approaches? There are a couple committees that are formed within the workplace. And the dual committee program structure, one is a design team, which that's me and you, the nitty-gritty kind of people, the workers, the people who are going to get down and really analyze the health and safety concerns in the workplace. Then we have this other thing called the steering committee. Those are the people who can put the money into the programs and make some administrative decisions as to how these things are going to be done. So the dual committee structure really engages employees at identifying, more than scratching the surface, really understanding the deep-seated health and safety needs of the workforce. It also helps with this communication. The dual committee structure is important because in a lot of workplaces, if you put management and workers together to identify some of the areas of concern and what we might do about these, there's a lot of intimidation. There's a lot of, I'm lucky to have a job. You know, I'm not going to start to ruffle anybody's feathers. So the dual committee structure gives both parties sort of some autonomy and some confidence in participating in this process. The ideas tool, this is what this whole thing revolves around, is the ideas tool, and that stands for Intervention Design and Analysis Scorecard. And there's a series of steps, which we'll get to in a moment. Each of the two committees has a set of roles, and they're identified here, and you can look at them. But again, this dual committee structure allows for the full participation of those folks who are on the ground floor, doing the work every day, who can really help to identify some of those health and safety concerns, and prioritize which of those might be important to address. And then again, the steering committee is working. You can see that there's action and feedback loops here that have to happen all the time. But each of these committees really have a role to play, important roles, I should say, to play in this process. So the first thing is having these two committees. Don't be overwhelmed as I get into the steps of this ideas tool. It's a very common planning model. I mean, it's not anything that's too out of the box here, but this is really meant to be adapted. I think there are programs that have gone full tilt and used the entire toolkit, the entire set of 7 steps in the ideas tool, and sort of did it it was within a research context, so we hope that they did it sort of according to the letter. But in the real world, do what you can. Use what's most effective. Use the part of the process that might kickstart your new orientation to integrated approaches and participatory approaches, and then take it from there. So we don't assume that this needs to be picked up as one unit and implemented in each place as this one unit. Use it as you see fit. What's in here, and this is all right on the website, and it's on the back, and I hope you'll visit our website, but it gives you a lot of tools. Hopefully a toolkit would. Readiness and resource self-assessment. There are some tools on there that, are you even ready to go here? You know? Are you even ready to start in on this process of participatory and integrated approaches? That's important. So there's maybe an adaptation to this, but in terms of what we feel, for a lot of different reasons, we do feel having a design team and a steering committee as separate, but working together kind of, and you're going to see when we get down to the actual ideas tool, you're going to see they play different roles, but there's always going to be that cross-fertilization of ideas, perceived needs within the organization, and certainly that importance of resource allocation to address certain health and safety concerns in the workplace. So we do advocate for this dual committee, but it's not like the little people go to the big decision makers. It's really more of a collaborative process than that. But again, it gives that design team gives a lot of freedom and a lot of, again, autonomy. And you'll see in the process how important that can be to, again, having an authentic participatory process. Because sometimes if, again, that administration or that management is within earshot, it feels a little less comfortable to really talk down and dirty about what you perceive some of the problems to be, right? Do I want to say this in front of my supervisor, my manager, the CEO, et cetera, depending upon the size of the company and who's involved. So that dual committee structure, they're not sort of parallel. They're really integrating, but they each have their own time, their safe time to sort of do their own work, which again, some of those roles have been very clearly articulated in the toolkit.
Is this design team like a cross-functional team? Various groups across the organization would be participating in it?
You know, again, this is one of those, it depends on the size. You know, you talk about a huge workforce. This may be for a division. You know, you may have this kind of a process happen within a division of employees, so that they would be identifying for that 100 or 150 or 200 workers, they would be, or an organization may be mid-sized or small, where they have one design team and one steering committee that's really representing the workplace, the entire organization, if you will. So it depends. So I think you can subdivide. There may even, within a larger workforce, there may be divisions or departments or units that are more amenable to this. You know, when you go through a readiness check sheet, which I'll show you in a second, it might be, well, that division is quite ready. This division, on the other hand, ooh, we have a little work to do, and I'll tell you what some of those indicators of readiness are in a moment. So it may be you pick and choose a little bit depending upon how those different segments within the organization, how prepared they are to engage in this process. So these are the steps we're going to go through really quickly. So program, again, there are tools on there. How do I form a committee? What are the important components of a design team? Who should be on it? A really important thing about a design team is that a design team has what we call a facilitator, somebody who's sort of the convener, if you will. Usually a member of the unit itself. It's usually not the CEO who's there saying, who's saying over there. It's usually a member of a HR team, a Worksite wellness team, occupational nurse. You know, those, it depends on who, but the facilitator brings a certain sense of leadership and organization to the process, which is really important. And again, there are many worksheets and forms you can fill out on this. I think this may go right back to Staples, let me just tell you. I'm a little too. So anyway, so here we go. So here's the website for our Healthy Worksite Toolkit. And you can go right on there, and again, it's on the back. I have some materials for you. All wonderful menu. This was a lot of work, and it was a lot of, Suzanne Nobrega, my colleague, did tireless work to make sure that this was a tool that made sense for the audience. What you'll see on here, just a few little snippets of what you might get if you dig in here. Again, to do an integrated and participatory program, you have to be ready. And how we help you to define readiness is through this online tool. And there are 9 items. One item here is the first assessment. This is a screenshot, actually. So is senior management willing to commit to a participatory safety, health, and wellness program for 9 to 12 months? This is not something that happens in 2 weeks. It's not something that happens, you know, in a quarter. This is something that has to be committed to over a longer period of time. Senior management has not yet made that commitment. So that would tell you something. Ultimately, you go through the 9, I think there are 9, actually. This may be an older slide, but there are 9 assessment items. And they include senior management commitment, willingness of workers to participate. Are you going to be able to convene a design team? Or is there some work you have to do on, they're not used to participating. They haven't been asked before. So now you're asking? You may have to build a little relationship there. You may have to build a little trust there so that this is understood by them to be an important part of the health and safety program moving forward. Willingness of management to form a steering committee. They have to be willing to, as a steering committee, which may include decision makers in terms of resources, people in leadership management positions have to be willing to participate in this project. Is there a facilitator available? Is there access to resources? This isn't necessarily free. It doesn't necessarily have to be a big budget kind of thing, but are you willing to put forth some? So this whole little assessment tool gives you some ideas. What you end up with at the end is a nice little feedback, because depending upon what you answer here, you're going to end up with some answers that we have provided. If you have not developed senior management buy-in, here are some tips on how you might want to do that. Because it's not like you've taken this online readiness, you're not ready. See you later, come back when you are. We've tried to build in some ideas of, if you don't have these 9 important variables to start this program off on the right foot, here are some things that you might engage in over the next 6 to 9 to 12 months to really get yourself to a position of readiness. But it's good to know what those 9 criteria might be for a successful implementation of a project like this. So it may take some investment prior to even bringing up the idea of this particular toolkit's activities. Also, what we have here, we have fillable forms all through the toolkit. So again, it becomes the tools of what the design team are using to actually hammer in on what the health and safety concerns are of the organization. Those are very helpful to people. This is another way to look at the design process. And again, what you'll notice is there's all this interaction that happens around the various steps in the toolkit. And you'll notice the design team has primary role and responsibility in identifying the problem, setting some measurable objectives. How are we deciding which interventions are the best interventions? And then what are our selection criteria? And I'll get to that in a moment. Then you kind of pass the ball on. You've decided as a design team, this is what we want to focus on. We have looked at, you know, the costs of we've looked at the benefits, we've looked at the barriers of this particular intervention, but this is what we're putting forward as our idea. And then it's given to this steering committee so that they can, for themselves, rate the intervention. How many people are going to be affected by this intervention? 2? Well, that might not be terribly compelling. The entire organization may be benefited by this particular, that's a sell, that's great. The scope of the intervention is potentially huge. So again, going through what the criteria are, and then certainly the design team working with the steering committee are then implementing whatever the intervention might be and setting up an evaluation process so that you know, in fact, did that intervention actually address some of the health and safety concern that we had from the beginning? Did we achieve our measurable objectives? Did we actually make a dent in addressing the health and safety concern that was not put on us by our supervisor? It was a design team process. We came to this decision as to what health and safety concern we were going to deal with first. The health and safety concern that you would have chosen. Because the design team is working from their own perspective and hopefully using data. Might be workers' comp data, might be job satisfaction or customer satisfaction or other kinds of data tools that you've had over time. They're using, but again, I wish they would have worked on job stress, or I wish they would have, as the facilitator or as the people who are kind of using the toolkit. But this isn't meant to be a one-shot deal either. This is meant to be an iterative process. We deal with this health and safety concern now. Well, we can hit the rewind button and then move on to the next set of concerns that people might have. It's really meant to be part of the organic culture of the organization, not something you just use and then move on to the next great thing. Hopefully it changes part of that organizational culture where you have people integrating health and safety with wellness, and you also have participation is the rule. It's not the exception, it's the rule. And having that design team, you may cycle people in and out of that design team. I mean, to me it is, maybe people do a 2-year term on the design team, and then they cycle out and they maybe cycle back in after a period of time. To engage more of the workforce, I think, would be in the best interest of the organization. But again, to start out with, that design team and the role of the design team is really critically important. But again, you do have this dual committee structure. There are adaptations to that, but you can kind of see the design team is really generating the ideas for interventions, but doing it with a thoughtful mind. And when we get to key performance indicators in a minute, we're not just saying, let's buy everybody new workstations. Well, that's high cost, and do we really need that? It's using some key criteria to help almost prioritize or rate the interventions so that they have a better chance of being successful.
It actually, at a former employer, it reminds me the concept of rotating the design team and integrating it into the culture. We did something similar like that when we introduced the Diversity Council. And so you were part of a Diversity Council for 2 years. You were on that design team. There was a steering committee, and you generated the ideas of different initiatives that became part of the culture. And it's a great model. It worked very well. Diversity then became not a program for the year or the flavor of the month.
Exactly.
It became part of the way we operate. And this is very similar to that.
It is very similar to that. And it takes some organizational commitment, right? So it does take a little bit of that readiness assessment to know if this organization is actually ready for this, if the leadership is actually ready for this kind of a commitment to people's time. Because maybe it means meeting twice a month. Maybe it means in the beginning startup. Maybe it means even more than that. Having a facilitator actually have 4 hours a week to work on this health promotion and occupational health program. It takes some commitment on their part for sure. So again, even though we see the design team has the primary responsibility for convening to address or to begin to identify health and safety concerns, certainly the steering committee may chime in, right? Because maybe they have access to some other data, and so this process is not meant to be linear one. It's certainly meant to be an iterative one, and one that really encourages communication between the steering committee and the design team. This is my slide where I say, can be messy. You know, this whole idea, this design team working together, people don't have the same ideas about what the critical health and safety concerns are. It might take a little while for that group who's been asked to participate on the design team to develop a little bit of a rapport with each other, depending on, they might not know each other very well. So now we're going to start to really talk about the working culture and the health and safety concerns that face us as workers in this organization.
And I just wanted to express too, this is kind of a new model for a lot of you, but I'm reminded that a lot of the work sites here today talked about, I want to be refreshed, I need some new ideas. What you need to grasp, from what I see looking in, is that you have your audience at your work site, and you have to engage them. We're here to show you what's out there as far as connecting you to low or no-cost programs in the community, and that's exactly what I do, all of you know that. But you have your audience, you just don't even realize it. It's right in your work site, okay? And this is a totally new thing for all of you. So I just want you to keep that in mind, okay? Keep that under your hat and just kind of, flow with it. Because I think about the work sites that are here, and this is totally new for them, but I just think about how good it's going to be once you implement it, even though it's going to be a little, it's going to be a little messy, like Nicole's saying.
It is messy. And you know what it also does is it has us relinquishing a little control.
Yes.
Dare I say it. We all like to have control. And again, our silos feel comfortable. We know, that that's our place. This opens it up a little bit. And it really does stretch people's comfort levels sometimes. But again, back to a slide. I'm not even going to play with this to go back to the slide. But, what it can do for the employee. Self-efficacy. I matter here. I mean something. I'm contributing in this way. So what you're investing in is well worth losing a little bit of that control and maybe getting a little challenged in terms of comfort. Because planning a program and implementing a program, that's kind of easy. We'll call the people we need. We'll get the logistics all straight. That's fine. But that's like a chess game, or a checkers game. It's moving the pieces. This is engaging people. And that's very unpredictable sometimes. So, but well worth it.
I just want to see if I can add something to this. There's also some new research that's coming out in the accounting world that is actually trying to take all this concept and develop it into employees are assets and not just liability. So making
Novel approach.
an actual physical business asset, though. When you look at the paychecks and your payroll that you're always giving out, it's a liability. But now, if you can integrate this type of model into a business, now that those employees now become assets because they're engaged, they're actively part of it. So there's some research at Brown that we're part of that is actually getting this up and running to make an economical, actual tax asset to a business.
The last time I was here, we talked a lot about job stress, and we talked about sort of those unhealthy working conditions that lead to unhealthy behaviors in many cases, and that often leads to things like reduced productivity and higher cost. But in fact, if you flip that equation and say, we're going to engage and we're going to work to have a healthy work environment, a healthy culture which involves participation on all levels of all employees, we're actually going to not only increase the productivity of the organization, but we're going to do so while maximizing the quality of life for those individuals as well, and really view them as assets to our organization. I think that's pretty cool. So what you have, again, these are the fillable forms. This is an example. And the first step here is, all right, let's identify a problem. And then beyond that, again, it's what are the root causes? That's another part of the engagement. This is just an example. Root causes of this neck, back pain, shoulder pain is maybe it's poor physical infrastructure. Poor furniture and equipment is set up not well, but you have a lot of ergonomic risk factors. Constant computer use, not a lot of breaks, no real culture for taking breaks exists in the organization, and maybe there's also this lack of personal physical fitness. And then what you go down is you then talk it out a step further. Let's dissect this out and really come to what are some of the contributing factors of this issue of furniture and this issue of ergonomic design. So again, this isn't something that happens in a one-hour meeting. This is something that you really facilitate and process. Believe me, I'm a person who is very sensitive to the idea that you can over-process. and never get anywhere. So it is about finding that balance, and sometimes I can go the other way and just want to do something. That's the control freak in me. But this process really is about giving the time to the process to let unfold some of the ideas of, yeah, we have neck pain, back pain is like prolific in our organization. Let's talk about that a little bit. What are the contributing sub-issues to that? And then what contributes to that? And then, ultimately, how can we address that? And we address that through the framing of good solutions to each of those sub-issues. We have a furniture issue. We have just a work culture in terms of sitting at your desk all hunched over and not taking any breaks. And we have a lack of personal fitness. Those are all things that could be tangibly addressed. So how do we frame the solutions? And again, this is a process. We're in step 2, only step 2 here, but we start to look at, all right, we've said neck, shoulder, and back pain. That's our focus for this particular issue. Well, hey, how about based on those sub-issues, based on those contributing factors, what are 3 ideas? This design team doesn't come up with a single intervention. We encourage the design team to really brainstorm at the beginning. What are some of the interventions that may help to address this common health and safety concern of neck, back, and shoulder pain? And again, I don't need to get into the nitty-gritty of the particular intervention ideas, but here's a solution. And here are some specific activities that would lead to that solution of better fit, better ergonomic environment for the workforce. And these are some things that potentially could happen that would solve that problem. And again, it's that iterative process. Who's doing this work? The design team. Who's the design team? The workers, with a really good facilitator helping to elicit this information to get to a place where you're ready to set your criteria and better understand your issue. Now, again, selection criteria, it's easy to sometimes say, oh, we all need new office equipment. Go ahead. We'll expect it by Thursday. What we also want the design team to do, and this helps them to speak the language of the steering committee, is to understand or to think through what's the scope or the impact. What are the benefits or what's the effectiveness of this particular intervention? What are the resources and costs? And what are some obstacles and barriers that might exist? So for each of those interventions, they dig a little to really determine, these are some of the things that, oh, I don't know, might be important to the steering committee. So if you engage with these questions and with this understanding of criteria with the design team, I think they can probably suggest a more realistic intervention and a more desirable intervention based on who's impacted, what they're going to get out of it, understanding of resources and costs, and also perhaps setting up a situation where some of those obstacles and barriers can be worked into the intervention so that they no longer become the obstacles and barriers that keep things from being successful. And also, I mean, this is also an important thing, and I sort of just said this, you need to make a business case to the steering committee. You know, they do care about the health and wellness. Remember, back to my straddling, quality of life and economics. They care about, I think, the quality of life of employees, for sure, but also this helps the design team to understand and be sensitive to the business case. How it is that design team, that steering committee is going to come to a decision that, yes, we will act upon this intervention idea. So again, that business case and these criteria really help the design team to see a little more eye to eye with some of the variables that really affect decision making within any organization. Because sometimes we're sort of blind to those kinds of things as just worker bees. So again, apply that criteria to each solution. This is what the worksheet would look like. Again, given the tool to do each of these steps, I think is an important part of the toolkit. And looking at the various activities and then have a grid for each of those key performance indicators or those different criteria so that, again, you're not comparing apples and oranges. You're really looking at, according to the same criteria, here are the ideas we had to deal with this neck, back, and shoulder pain. So what's really looking like the best alternative at this point? Again, more solutions. More solutions, again, with the criteria of helping to assess who's affected, what are the benefits, what are the costs, and what are the barriers for each one of those assessment ideas. And the rating. This is another piece of the puzzle. And again, this is where I always go, oh God, they think this is too much. It's, again, pieces of the puzzle, you know, pieces of the puzzle. And let me also say the website, and can you please back me up on this?
Yes.
We have video tutorials
They're
for each
awesome.
step. We're conducting webinars which help people to understand each step of the ideas tool and how they might make it work for their organization. So I only wrote 40 minutes or something today, and I'm throwing it all at you. But I want the website itself, these video tutorials I think are exceptional, and they really walk you through each of the steps and how you might make that step work for the organization that you represent. For
Absolutely.
sure.
I can't agree with her enough. I go there to get my information to bring it to you as a work site. However, it's right there for you to use it. Again, it's a lot of content, but remember, you can kind of pick and choose what you want to use, but the other great thing is that it's free. You're getting it from a college, so it's in a tutorial form. You're their student. Everything's laid out for you. And the great part is that it's evidence-based. So you know it's gonna work. And every work site is different, okay? You're all different, correct? You all have different needs, you all have different employees and so forth. So I think that, that's really important, and just all the tutorials are really, I think they're very helpful, so.
And again, we have webinars that have been going on for the last several months for people to call in live and get their training. But those are all archived too, so you can listen in on what those tutorials have been over the course of time, which I think is part of the readiness. If this is something that you think you might want to engage in, at least to scratch the surface and see, to me it would be about maybe allocating some of your work time to really dig in. I mean, today is just a very brief overview, but then hopefully you're prompted to maybe want to go in and see a little bit more of what the website toolkit has to offer. So again, at this point, we sort of flip it over to that steering committee. We've done our work. We've identified the health and safety concern, we've set some objectives, we've brainstormed some interventions, some solutions. We've then even gone a step further to understand how we might justify the need for this intervention. And now we're passing it off to you after all of this hard work, you being the steering committee, to really determine what the next steps might be. The steering committee does the same thing, because you know what? The design team assessment of these 4 indicators may be very different than the management team. So the management team goes through the same kind of analysis. They look at the solutions, and they weigh in. This is definitely a low impact solution. This is a very high impact solution, and they may then compare and contrast the perception of the design team with the perception of the steering committee when it comes down to actually evaluating potential solutions to the problem. So we've employed this, again, the pilot test. We had 4 organizations and did it from a research perspective, so we really wanted them to be married to the toolkit process so that we could evaluate the results. What I'm telling you is, you're not part of that research study. You take what you want, you use what's applicable, you throw the rest away, you maybe realize, oh, I shouldn't have thrown that away, let's bring it in. It's that kind of rolling with how this toolkit meets the culture of your organization and your particular needs and the positions that you're in. But, interventions that have actually come to fruition, a few things. Resident education materials for move-ins. It was a real estate company, and it was a management, sort of like the maintenance crew for a very large condominium complex. They had multiple geographic areas. And one of the things was people would call them for silly things. So they really invested in educating new residents and making maybe it a little easier for them to troubleshoot in their own area. Not that they were saying, don't call me, but it was a way that minimized the number of really, I guess, not unnecessary calls, but they were able to develop resources that tenants or owners could really use. New uniforms, this is one of those, I wouldn't have chosen that, but in the same work organization, the guys were saying, and it was all males, what they were saying is, these uniforms do not work in the summer. They're horrible in the summer, et cetera, et cetera. So one of the things, and again, that was one of the first things they did. From our perspective, it's like, okay. But it was their thing. It was going to improve the quality of their life on the job in the months of, I don't know about this year, June, July, and August, based on how we've been going here, but that was another intervention. They changed how work orders came through. Some of it include technological applications, and others, it was just about communication, enhancing the communication system. These guys had incredible stress in terms of workload. They were being called by getting pulled in 1,000 different directions. So that was one of their main things, was job stress. So how it is that we can come up with a process for delivering work orders. This is work that needs to be done within the condominium units, but can't we facilitate this process a little bit better so that, again, workload is better managed from the perspective of the worker? So a lot of really good stuff came from, those are specific ideas that worked for those workers and that design team. And this is something the steering committee, all 5 of these said, yes, let's do it. Let's do those things. And in general, in terms of the organization, I did some of the evaluation work, some of the focus groups, and what really came out to me in that was how important the design team members felt. Their role was important, and they saw results. They saw how their ideas and the process they went through, they weren't just saying, you should do this. It was a very well-conceived, facilitated process, and what they were able to show to that steering committee, the decision makers, was a compelling argument. And what they brought back, the workers also reported they felt like representatives of their peers who weren't on the design team. But even when they weren't just themselves participating in the design team, they found that their coworkers were using them as conduits. Bring this to your design team, and really eliciting a lot of input from employees on each step in the process and what their ideas might be. So the design team actually functioned as sort of a convener of ideas from that enhance what? Health and safety. So back to the 2 main items here is it's integration of occupational safety and health issues with health promotion. And it's done through a participatory vehicle. And that's what the toolkit offers. That's it.
The maintenance workers, their main concern was job stress or?
It was workload.
Workload, okay.
It was just like, oh my God, they felt buried, and they couldn't, and they never felt good about what they were doing because they always felt like there were 30 other things they needed to do, even when they accomplished this first task. So a lot of it was organizing the tasks. It wasn't saying, oh, we'll cut your workload in half. That wasn't really an intervention option. But it was the idea of how do we improve the flow? How do we improve the communication? How do we improve the flow? How might we use technology to help facilitate this? But again, team members. Lots of chirping.
Okay,
So we'll stop there. Thank you very much.
Great questions, great questions. Just some housekeeping. The